Yeah, let's go ahead and get started. I want to thank you all so much for joining us. We're really excited about this session. Um, UPower has, as many of you know, a research pilot project program, and we have three really strong projects this year that we're excited to share with everybody. And presenting today will be Tallulah Pontuti, Megan Hebden, and Ryan Olson. And I'm going to head and hand it over to Tallulah to talk about her project.
Great, thank you so much. I'm just gonna get this set. Perfect. Everyone's seeing what they need to see. Cool. Okay. Hi everyone. Thank you. My name's Tallulah Pontuti. I'm a PhD student in the School of Environment, Society, and Sustainability, studying geography. And I'm here talking about my pilot project for understanding agricultural labor accountability in Utah. And so just a big thank you to you all at UPower for the support on this. Very excited and excited to connect with everyone here. And I also would like to thank my mentors, Dr. Andrew Linke and Dr. Adrian Cashlin, on this project. So I'll get right into it. So first, I want to set a little bit of context and get us thinking about agricultural workers in the U.S. and kind of touching on some of their existing conditions and experiences here. So agricultural workers are a unique workforce in the U.S. They're invaluable members of our community and food system. They make up 6% of our GDP and over 10% of US jobs, and they really add to our cultural wealth, our communities, and make us more whole. But they're also a vulnerable population that experience unpredictable weather and climate, extreme working conditions, unequal exposure to pesticides, and unsafe chemicals. And all this is compounded by their limited access to healthy living conditions and working conditions, such as wages, healthcare, food security, um, all these things I know you all are very passionate about in this space. So, um, at a larger scale, they are having to operate a system that's really dependent on the exploitation of their work. Um, so, just framing this a little bit nationally. Excuse me, of course, I have a frog in my throat as soon as I start talking. In Utah, our farm workers cover numerous job types. We have growers, herders, ranchers, and more. And as of 2022, there were over 30,000 farm workers in the state, um, and working across about 18,000 farms. And in 2023, we had about 2,000 H-2A positions operating. So just as a quick primer, that's the federal visa program that brings in seasonal agricultural workers into the United States. And so this agricultural industry as a state was worth about 3 billion that year. So there are various policies and programs that facilitate agricultural workers doing work here in the United States. And the dominant division that manages the protections of agricultural workers is the Department of Labor's Wage and Hour Division. So this division does much of the enforcement for agricultural labor violations. So thinking about like wages, breaks, resource access, through policies such as the Fair Labor Standards Act, the Migrant and Seasonal Agricultural Worker Protection Act, and the H-2A program. Excuse me. And here, I want to talk about a little bit about this wage and hour division. So in the first graph on the left, you see that investigations are decreasing over time, investigations that division is carrying out. And that's not because of fewer problems going on, but it's about lower capacity to be able to carry out those investigations. So we see a pretty significant drop since 2000 to around 2021. And then on the right, we also see that the funding for the wage and hour division has roughly been the same since it's 2006. And I'd be surprised in this political landscape if we're going to see any big influx of funding into that program. And so in Utah, there aren't significant added protections for farm workers. And while we do love our agricultural community culturally, our actions haven't shown the most support. For example, In 2023, the Utah Farm Bureau president was caught on camera abusing one of his workers after many of them confronted him for withholding wages. Yeah, 2023. And then also last fall, other farmers were caught trafficking migrant workers and kidnapping a child to work for them across state lines. And through these federal wages and investigations, uh, over $650,000 in back wages were gained, and around $300,000 in civil money penalties were given to farms. So, Utah agricultural workers really face ongoing challenges in this space, including the low wages already, limited access to security, and it really highlights a gap in understanding how agricultural workers in Utah are supported by institutions and organizations amidst all these like rapidly changing conditions, economically, politically, and environmentally. And so, with that, there's also such high risks in reporting employers for worker violations, which is not surprising. Um, and so the violations that are occurring are likely an undercount of what's happening, which, again, we aren't quite surprised by this. But this is a concern when thinking about total worker health, and as it illustrates shortcomings in our system of how we promote worker safety and well-being. And so this leaves me to be generally curious about, with these challenges of under enforcement at the federal level and challenges at the state level, can publicity of agricultural labor violations potentially be an effective method for self-regulation in this space? And this leads me to the following research questions for this pilot project. So first, I want to look at what are the prominent types and conditions of federal agricultural labor violations that have taken place in Utah. And then, to what extent are these violations portrayed in the news for transparent information access? And is there any correlation between agricultural labor violations and their publicization in Utah? And to do this, I've pulled the federal agricultural labor violation investigations that have happened in Utah from 2000 2023. I'll expand to 2024 for this project. Um, and that's shown here on the right. So these are the individuals and cases investigated. So we definitely see too many. Um, Good that they're being investigated, but too many instances where they've needed to. So this data that I'll show an example of in a second includes data on the farm address, the company name, the type of violation that was committed, number of people that were impacted, and some information about like monetary values that were placed on these violations, which of course like isn't the only important thing in these conditions. Just to show an example, and this is a really like slimmed down example of what all the information is available. But yeah, you can see the name of the farm, address, the type of industry of farming that's available, total wages agreed to pay, the date of when these start, and there's also dates on when these investigations end, whether or not the violations occurred through the Fair Labor Standards Act, like that first spot you're seeing. Oh, sorry, I will overlap the screen here. Along with, if those were minimum wage back wages paid, if it was overtime, and whether it was through the H-2A violation, if it was an H-2A violation. So it kind of shows us a lot of detailed information. Unfortunately, it doesn't show information about the person who experienced these violations. So, we won't be able to tell things about like gender or more complex identity pieces, but I do think it'll be telling a bit if the violation is through the H-2A program or that Migrant Seasonal Agricultural Wages Protection Act, to get a little bit more nuance on whether, since people in those programs traditionally have identities that are discriminated against, I think there'll be a lot there. So first I'm looking at what all these are looking like and where, kind of doing a deeper quantitative and qualitative analysis. And now that data is sourced from the Department of Labor. And then I'm going to be doing an original database creation of the representation of these cases in media. So first I'll be starting with online media and archives. So I'll be looking at how and if they've been shared in the news and identifying any presence of correlation with violation location. And this will be great because thanks to this grant, I'll be able to have a research assistant to help me do this process, to create a robust research analysis and utilizing media studies methodology for this, along with agricultural labor communication foundations to guide this process. So ultimately, in this pilot project, my goal is to answer those research questions I talked about and set a foundation for future work and looking at how, when we think about the limited capacity for institutional support for preventing agricultural labor violations, especially in these communities that are often forced to exist in vulnerable contexts within capitalistic exploitation, thinking about how we can leverage other pathways of support and communications in agricultural labor protections locally. So that's my quick overview, and I'm super excited to answer any questions or talk to folks about this. Really appreciate all of everyone's expertise here, and I'd be happy to answer any questions.
I've got a question. I'm curious about what you foresee going into that database of media violations, because I think this is such a fascinating idea, especially if regulatory power is going to be lessened.
Totally. Like just kind of generally what I've been seeing so
Yeah.
far.
Or just kind of what kind
Totally.
of things are you recording or looking at?
Totally. So I'm really interested to see um basically, repeat violations. So themes in farms that, keep repeating yeah, violations among farm workers and some spatial distribution I think might be interesting. So as you saw on that map, like kind of a lot of some of the rurality of it. And then also thinking, and this might be like the second phase too, but I know, a lot of farmers really do care about their workers in ways, but are also operating under intense conditions. And so maybe seeing if, this isn't necessarily a process to shame farmers or farm owners, but also to see like where could they use support. So maybe if there's clusters of areas that are there's a lot of H-2A violations, or challenges working with migrant workers to see, maybe there's opportunity there to help them as well, because they care too. So I think kind of maybe hoping to tease out some of those themes is really important. And then also seeing, from the state side, how we can help support that. So, all this is federal data, but I also have been I did like a Freedom of Information Act request from the state labor violations, and I'm digging through those too. So, seeing where those can tie in. Um, but yeah, really thinking about industry type, um, and yeah, where the dominance is between kind of these, migrant worker violations and maybe other types too. Yeah.
Thank you so
Yeah,
much.
thanks. Hi, Frank. Yeah, thank you.
Um, I I thought I should raise my hand. I didn't want to interrupt. Sorry. So this is fantastic. It's really super interesting. One of the
Thanks.
questions I have for you is, so I'm wondering, um, of course, there are persistent media and non-persistent media. So that's my first
Mhm.
question. So how would you actually, and I am not familiar with media analysis as an approach, so I'm curious to learn more about this. So my first question is, how do you actually, how are you able to, for example, look at news reporting on TV and all of that, which I would categorize as non-persistent? I mean, it's,
Mm.
gone in some ways. That's the first question. But the second question I have for you is, um, I suspect, except if you are, the chair of some committee or some major organization, um, these events are kind of not such reportable events. I mean, they are not catching so much interest, except if it's a prominent person. Um, how do you think about the relationship? So I'm nervous that when a lot of stuff is going on in the world, these days, for example, I don't know what you have to do to get into the media because there's so much
Totally.
reporting about other things happening, and so there are certain terrible events. If I look at your data, for example, 2000, includes 2002, um, for probably
Right.
2, 3 months, the media were shutting down reporting on anything but September 11th. And so,
Totally.
so there are other historically significant events. And I'm thinking about the challenge, and maybe you will teach me and tell me in a moment, oh, local media, they are actually having a broader bandwidth. They are doing some of the local reporting and that's picked up, but not so much at a, statewide level or so. So how do you compensate for this? And, or is there a, experience in dealing with these things? Thank you.
That's a great question. Thank you, Frank. So that's actually my hypothesis that I haven't quite even been able, I didn't really get into here was that there's not going to be a lot of discussion about these incidents. And I think that's, this a story in itself about how we're not talking about these publicly and how we're not talking about it as a community, aside from, people who are organizers or work more directly with farm workers. But I think if I'm not finding that much. It'd be, how do we start to talk about this more as a broader community and bring these ideas to light past those who, local organizing groups and, labor organizing. So I think it's, and I'll answer your process question too, but I think that's like also part of the story, and I think is a really great point that you bring up. And I hope that will either lead me in the direction of like, okay, you know, again, this is just like one phase, but I think it'd be really interesting to then talk to, different organizations across state and how they're thinking about preventing these issues and kind of bring that into the story of some further work. Um, is my, you know, the part that I think will be challenging about this is seeing what there is even available. I found some things so far, but your point exactly. And then for process, actually wasn't, I was planning on starting with all online media sources. So, online news, probably exploring blogs too, and kind of working through that process. And so I wasn't initially going to be starting with TV that doesn't get recorded into an online database. But I think that'd be really interesting to do. So that was a good thing to bring up. I appreciate that. What I was planning on doing and what I'm still learning about and excited to kind of work through this process is the most effective way to do this. So I was planning on working with my research assistants and creating kind of like a qualitative quoting process, but going through creating almost like a code book, in a classic kind of um, coding system and, searching through key databases online through the university and through Google Scholar and kind of doing that systematic approach using search words that come up from the violations that I use. So that working with one, if not two, research assistants to kind of then co-code and co-search so we don't miss anything and do the analysis from there. But I do want to look into your idea about TV methods too, because I was kind of that's the harder part with, like you're saying, with, for example, 9/11 or even just the early 2000s, that transition from medias on, TV medias or radio medias to online content is definitely going to be a little bit more limited for sure. So I'm working through that process is my answer. Yeah, thank you.
Thank you. No, that's fantastic. I mean, one of the things that could be really interesting, and I think you mentioned that you're kind of thinking of doing this, would be to figure out, and I wouldn't know right now what a sensible process would be, but how much awareness is in a local community about, repeated violations.
Mhm.
So if you talk to someone, Farmer Brown, and so you say, hey, do you know about stuff? Can you tell me a little bit about, what's happening and how you think about it? Do you know about others where there have been violations and citations and all of this handed out? So that could be
Totally.
a blip of, how a local very localized community is experiencing it, not at the state level. So
Totally.
I think that because you were mentioning organizations, and I think individuals might actually know a lot about it, but again, then it's
Totally.
like family secrets, everyone knows about it, no one talks about it.
Yeah, that's definitely something that I would love to do in the future is interviews. I think that really ties into the deep part about this. And I've been doing Salt Lake farmer farm worker interviews on some related work with UPower. And so I love that idea and hope I can do it in the future. So this is kind of like a first stage for sure. Yeah, so I appreciate your thoughts there. Thanks.
Thanks so much. I'm going to hand the mic over to Megan now.
All right. I'll get my slides loaded. Can you see those?
Yep.
Yes? Okay, great. Well, I'm really excited to be here with all of you today and with also one of my uh, MPI team members, Dr. Catherine Elmore. Our other team member, Sarah Small, couldn't be here, but she's here with us in spirit. So our project is focused on the financial status of women family caregivers, the case for paid family leave. So just to give a little bit of background about our team. So we all started working together last fall. So this application was kind of our first foray together into this space. And so there are two nurses and a feminist economist. We met in a Zoom room, and this is what we came up with. And so my name is Megan Thomas Hebden. I'm new to the university since August, but I've been an assistant professor for almost 4 years. I came to family caregiving research through a very personal space. I have a daughter with a rare genetic disease, and you can't see her face, but that's her and that's me. And we are wearing our Purple Day shirt. So I wanted to show this picture because Purple Day, which is an International Epilepsy Awareness Day at the end of March. So it's timely. And so that's why I do this work is because it's very personal to me. I want to give the mic to Kat to introduce herself.
Sure. So thanks, Megan. I'm also a research assistant professor at the College of Nursing here at the U. And what I almost included in this slide was a picture of me and my two sisters because we recently have cared for both of our parents at the end of their lives. And our experiences individually and collectively are part of what inspired my interest in caregiving research in general, but also the impact of things like employer supports. We each had very different experiences because we have very different employment situations and other background differences as well.
And then Sarah Small is in the Department of Economics, and her focus is on feminist economics. And so the alignment of focusing on women, family caregivers was pretty perfect for this project. So just some background on family caregiving. There are 53 million family caregivers in the United States caring for somebody with a chronic illness or disability. This is probably underestimated because often in these metrics, they're not including parents who are caring for seriously ill children. And so it's a much larger number. And of those caregivers, 60% of them are women. And the economic contributions of family caregiving are valued at $600 billion. So their work is really important and often unacknowledged. And just at the individual level, family caregivers contribute on average about $7,000 a year to family caregiving. And this could be to cover like medication costs, durable medical equipment that isn't covered by insurance, travel, special diets, all sorts of things that often our healthcare system doesn't cover and the family caregiver has to pick up. So socially reproductive work is undervalued in the United States economy. So we really value working and certain types of work, but for people who are staying at home, whether they're like a stay-at-home parent or they're home caring for somebody with a chronic illness or disability. This is immensely undervalued in our country. And if you compare us to other developed nations across the globe, we are seriously lacking in policies to support this type of work. So our focus is on paid family leave because for a lot of caregivers, they can't afford to just be at home because they don't get any sort of stipend or support to do that. And so they're trying to juggle this really difficult balance between working and caring for somebody with a chronic illness or disability. And if any of you have had that experience, it's very unpredictable. So working caregivers often have to take periods of leave, often unpaid. Sometimes they have to switch jobs or positions. Sometimes they have to go down to part-time or leave the workforce altogether because of their family caregiving responsibilities. And just coming at this from a personal space, I'm a nurse. You really can't leave your patient when your daughter is having a serious medical emergency. And so I found myself in that really difficult situation of having to choose my family over, well, one part of my family, which was being there versus my family's economic well-being. And so just some background on paid family leave. There are currently 13 states plus the District of Columbia that have mandatory paid leave policies at the state level. There are 9 states that have voluntary paid leave policies, and these are usually through private insurance companies. And then looking more locally at Utah, there's nothing. So there's FMLA, which is a federal policy. That's the Family Medical Leave Act, and that allows for 12 weeks of unpaid leave for certain types of workers. But often people who are in low income work don't meet criteria to receive even that unpaid leave guarantee. And so what we do know about paid leave is that paid family and medical leave can improve women's labor force attachment, wage maintenance, making it rain with the money, financial security, and decreasing the stress of caregiving because you actually have an income to support that $7,000 that these caregivers are paying out of pocket annually. And then can also contribute to better health outcomes because another thing we understand about family caregiving is that these caregivers often forego their own needs for the sake of the person with the chronic illness or disability. And this can be medical needs. So they can have serious chronic illnesses themselves that go untreated or undertreated for years. So the purpose of our project for this UPower pilot is to integrate secondary data analyses using 2 national data sets. So there's NSOC, which is part of the, I'm going to forget.
The
what
National
the
Study of Caregiving.
Thank you.
Which is part of NHATS, National Health and
Aging Trend Survey.
Thank you.
There we go. And then the American Time Use Survey. And then we're also integrating a state level data set, which Birthfest is a national data set, but there are also state level specific data that we're going to look at. And that's a CDC survey that is called the Behavioral Risk Factor Surveillance System. And then we're going to combine that with autoethnography and a structured literature review. We're not doing a systematic review, but just looking at the literature in a structured approach to combine data with story. And with that, we'll inform a state level and a national level policy brief on the outcomes for women family caregivers who are supported with who they're working and their caregiving and how that impacts their health outcomes. So we are using a theoretical framework called the conservation of resources. And so this was proposed by Hopfall, and this posits that resources provide the foundational understanding for stress. So this is a stress-based framework. And resources can be impacted by the environment and circumstances leading to loss. And so when we think about resources, these are contextual objects, individual characteristics, conditions, and energies that are valued and used by individuals to attain further resources. And so what we're proposing in our study is that resources include both financial and physical dimensions of well-being, and that's what these caregivers are seeking to maintain. And that the environmental factors include structural differences in power based on gender, race and ethnicity, and rural dwelling. And then that sources of loss related to financial and physical dimensions of well-being could be family caregiving responsibilities and work status. And both work and family caregiving actually function in the literature to be like helpful and harmful. So we're really interested to see how that falls out with our data analyses. So we have 3 quantitative aims, one for each data set. And so when we're looking at the NSOC data set, we're examining the financial impact of family caregiving, and specifically trying to describe the differences in financial indicators among caregivers, looking at these different subgroups defined by gender, race, ethnicity, rurality, and caregiving duration. And then when we're looking at the American time use, we are going to use this American Time Use Survey to look at state level paid family leave policies and how that influences the economic outcomes of unpaid caregivers of adults. And then finally, with the BRFIS data, we're going to look at how with Utah family caregivers, understanding how socioeconomic status are influenced by family caregiver contexts, such as care activities, the relationship to the person they're caring for, the caregiver's age, and the diagnosis of the care recipient. And then also looking at work status, sexual and gender identity, race and ethnicity, and rural. And then finally, we're going to do our structured literature review. And with that, we'll combine, it's kind of a modified autoethnography. It's actually going to be focused on my experience of working and navigating leave policies. But I'll be interviewed by both Kat and Sarah. And then we'll also collect some like, oh, I'm blanking on the word, Kat. That's exactly what
Artifacts.
happened. Yes. Thank
Artifacts,
you.
so photographs,
Yeah,
objects.
artifacts.
Yeah.
Yeah. So we'll combine the interviews with these artifacts. So this is an example of me and my daughter at the hospital during a health crisis. And so we'll bring these aims together using like a matrix display that will show kind of the overlapping findings or maybe differences among these analyses, to inform our final products, which will be some policy briefs. So where we are to date, we have submitted our IRB. We have hired 3 GRAs, which we're excited to work with. We'll have a great team to carry out this work. We already have data access to the American Time Use Survey and NSOC, and actually have both Kat and Sarah have a lot of experience working with those data sets. We're still working on getting access to the Utah level BRFIS data, so we're in process with that. So once we hear back from IRB and get the data access, we'll be ready to launch. So we're anticipating that in the next month. And so finally, what our ultimate goal is to kind of do policy research that can inform policy that will benefit these caregivers who are working. And we have a specific emphasis on women, but we also understand that in the current funding climate, we will have to expand. And we do think that it's important, like even though this is historically gendered work, it impacts all people who are family caregivers. And so we think our findings will be important across different populations. And so we're excited and eager to answer any questions that anybody has for us.
Thanks so much. Does anybody have a question?
Hi, I'm Julia, and I am um, a guest here. So appreciate you opening up this talk to others. I do paid family leave work, and so I'm super excited about this project. And I think it's such a cool contribution that you all are proposing to make by bringing together different data sources and having a mixed methods project. So mostly just want to commend you on this project and the idea for it. And I'm just really excited to see what you all find out. My minor question is just about the time use data and whether you're planning to link it. You know, there's a couple of waves of the leave module specifically that asks a set of questions about leave. Are you planning on drawing on some of that data, or are you using I know you can get at sort of caregiving and work time from the annual time use data. Which data are you going to try to incorporate into this study?
That's a great question. And Sarah is our American Time Use expert, but we actually have kind of steps with this project. We're proposing a second project that will be using the American Time Use a little bit more in depth for the paid family leave. So my answer for now, which Sarah will tell me if I'm right or wrong, is that we'll use kind of the basic American Time Use and then get that further in-depth data for the next stage of the project. Thank
Yeah,
you.
of course, that question is for Sarah, who's not here.
Yeah.
So,
Yes, with our limited knowledge, that's our
but
answer.
excited to hear about your interest in paid family leave too, Julia. Thanks for speaking up.
Yeah, we'll have to meet, maybe do a Zoom chat later.
All right, thank you so much. And I will also echo excitement for this project, particularly marrying data and story. That's one of my passions. So thank you. And I will hand it over to Ryan to tell us about his and Stacy's project.
Right. Does that look visible to everybody? Okay. So I'm speaking on behalf of our team. Dr. Stacy Stoffergan is a postdoctoral research associate, and she's here with us on the call and is available to answer questions, but is without childcare today. So I have the more predictable microphone status to be the presenter for us today. So our project is focused on new bus operators. It's titled Working Against the Clock, and is focused on the impacts of these employees who have very low schedule control and highly variable schedules on their sleep health. Other collaborators who aren't on the call today are Dr. McHill, who's in the School of Nursing, circadian physiologist at OHSU, and then Matt Thies, who's an epidemiologist at the University of Utah, and Joe Allen, who's an occupational health psychologist like myself. And Kami, do you know how I can hide the preview of the cameras on the right? It's blocking my text.
Let's see. I think if you hit the view up top, it should have a little like
Oh, there it is, little
or,
minus. Yeah. Thank you. So the list of topics I've prepared are as follows, similar to our other presenters today, and we'll just work through them, introduce you to our project, and finish with where we're at and field some questions. Sorry, having a clicker issue. All right. So new bus operators are a great population to study in terms of shift work, because most city transit authorities have a very similar onboarding process of training new people and putting them into service. It's also a union represented workforce, and as the lowest ranking, there's a tradition of seniority in the unionized agreements where new operators with the lowest seniority get the least desirable and most variable work shifts and bus routes. This includes, things like split shifts, but also not having typical weekend days, and so on. So some of the features that are of interest with studying new bus operators include these working conditions, especially those for our case that may be health and sleep disruptive. A split shift, if you're not familiar with it, is basically working what the workers call the shoulders, the heavy commuting hours with a large 4 to 5 hour gap in work in the middle of the day. So you have a very long spanning work day with unpaid off-duty time in the middle. Probable health impacts of these work exposures. There's 50 plus years of epidemiological research with bus operators. Sleep, diet, physical activity changes are probable impacts. Well, I should back up. There are definitely health impacts of the job, but there's less research on what's actually happening when a person starts the job, or how their health behaviors change over time. Well, you'll see some of our data. Dr. McHill has found changes in overnight patterns in blood pressure that are not healthy. And we have some evidence that new operators gain weight in their first years on the job. So I think it's a really important workforce to be studying work disrupting health, and in particular, sleep and health. Broader, we are investigating longer-term job satisfaction and turnover, but that won't be a focus of this pilot study. So sleep regularity, which is the consistency of your bed and wake times and your sleep and wake status from day to day, is an increasingly identified risk factor for health problems. Shift work in general is associated with a range of chronic disease conditions, and also safety incidents. So this is a crossover from a total worker health perspective where sleep is cross-cutting. It increases the risk for safety incidents, but it also increases the risk for health problems. The sleep regularity index is the most rigorous way to measure sleep consistency from night to night or day to day. And this is a minute by minute comparison of your sleep-wake status from one day to the next. And in a very large 60,000 worker study, the sleep regularity index was a stronger predictor of all-cause mortality than sleep duration, not by a large magnitude, but it shows that it's important. And in that study, shift workers were underrepresented in the sample. Shift workers get left out a lot of research, but they were overrepresented by a large percentage in the worst quintile of sleep regularity index scores. So in addition to health and safety incidents, a further total worker health concern is that work-life conflict is probably increased with schedule and sleep irregularity. If you don't have a weekend on Saturday and Sunday, but on Tuesday and Wednesday, that's going to impact your family life and personal life. And then also your day-to-day predictability in your schedule can make it difficult to arrange to be at and participate in social activities. And if you're doing shift work, you're negotiating complicated sleeping patterns with other members of your household, and are likely to be having lower sleep quality if you're sleeping in the daytime rather than the nighttime. So we do have preliminary data that led us to propose our particular pilot. Dr. McHill found among new bus operators in our shift on board study that overnight, skipped ahead a slide, that exposure to more variable and earlier morning shifts does increase sleep irregularity as measured by the standard deviation of sleep onset. this is kind of like of course, we've had reviewers of our grant applications say, oh, well, this isn't that novel of a finding, but it's actually pretty rare to show day-to-day work schedule variability is associated with day-to-day sleep variability. It's just assumed. And then further, Dr. McHill and his team found that exposure to variable and earlier morning shifts resulted in the first 90 days on the job a reduction in overnight blood pressure dipping. So it's healthy and desirable for our blood pressure to reduce by 10% or greater at night. This is one of our circadian rhythms, physiological rhythms. And within 90 days, this shift working proportion of our sample was predominantly displaying the non-dipping unhealthy pattern in blood pressure. And then finally, we took a look at a prior study with commercial truck drivers in a body weight management intervention trial, and drivers with higher variability in sleep duration had a lower intervention effect, and the most variable sleep durations were estimated to have basically zero intervention effect in an evidence-based, statistically significant weight loss program. So research gaps, this is a critical topic for shift workers in general, but especially for commercial drivers who do have a very safety-sensitive occupation. However, we could only find one study with commercial drivers with actigraphically measured sleep that addressed sleep variability and not just duration and quality. And they did not compute the sleep regularity index. There was no overall assessment of other sleep health factors, and there was limited attention paid to work exposures that might cause the sleep variability or contrasts between different workers with different demographics. So our specific aims are to first describe shift work exposures and multidimensional sleep health across priority demographic groups in a sample of new bus operators. And then our second aim is to identify daily level work shift dimensions that are most sleep disruptive. And we have a unique daily level work shift data set for a subsample of drivers from our bus operator study. So we can marry daily level work shift exposures with daily level sleep patterns. So a multi-dimensional sleep health perspective, the most popular model is the RU-SATED model. And this includes sleep regularity, sleep satisfaction, alertness, timing, efficiency, and duration. And we can compute all of these measures in our bus operator data set. For the overall sample, we can also include exposure in terms of work hours and then the percent of reported shift work time, self-reported. And then sleep measures with actigraphy, we can calculate the rigorous sleep regularity index, and then we can contrast exposures and sleep health across a variety of different cross sections, including those with high financial distress, men and women, and those with dependent children at home, just as examples. And then in aim 2, we'll get into the daily. We'll do a multi-level modeling at the daily level, looking at shift exposures, work start time relative to 8 a.m. and stop time relative to 5 p.m., and total daily work hours as predictors. And then we'll test the relationships between those exposures and daily sleep duration, efficiency, and sleep midpoint. And the image here is an actigram from, I think it's from a bus operator. It might be a truck driver. Typical, some variability day to day in the light blue, which is the rest intervals or sleep periods. I think it's a truck driver because there was from our team driver study because there was some sleeping in the afternoon. Um, so our data sources come from the shift ran onboard randomized controlled trial. The um, at 6 months follow-up, which is when we have their work shift exposure data, not just their train, at baseline, they're all just enrolled in the study and not driving yet. We have a sample of 146 drivers. So we'll accomplish aim one with drivers from 6 different transit authorities across the randomized controlled trial. And then aim two at our largest work site, we have 168 person days of work shift and sleep data to accomplish the aim two research questions. So I've made it through our talk, and I think we have a couple of minutes for questions if anyone has them.
I have a question for you. Emily,
yeah, go ahead,
sorry.
Frank. I talk to Ryan with some regularity. Go for it.
Okay. I'm totally thrilled actually to hear about this line of work because we did some work on fatigue in heavy equipment drivers here at Rio Tinto and in another mine actually up in Wyoming. And so we also used actigraphy. What system are you using? I'm curious because we developed our own.
Yeah, we're using the Actigraph GT 3X Plus.
Okay.
And we also have physical activity, but this is the wrist-worn device for sleep.
Yeah, so we actually, as part of the project, developed something that is compatible with Fitbit, so really low cost base, and allowed us basically to pull, their activity data, if you want, the actigraphy data, but also the kind of Fitbit scores for sleep quality, because actually they are pretty decent if you talk to people in this context. And the goal was really to model, like some companies are doing this, of course, to model fatigue during the daytime, which then, of course, creates safety risks, etc. And that was mostly the focus. So I'm really interested in learning more about this because this is kind of, I mean, again, all of what you said resonates totally, gain of weight, for example, during the first year. If you talk to it, we had focus groups with these drivers talking about fatigue management. And I mean, all of that is kind of part of what we also replicated, I guess, to be fair. So great. This is fantastic.
Yeah. Well, and I was not aware of that particular study of yours, Frank. So that's nice to know about, and we'll have to find time to talk. Just like Megan and Julia.
We published some of that stuff, and yeah, we can absolutely talk about it. I would love to. It was basically prior to COVID and during COVID, which made it really, really complicated. But yeah, absolutely.
Yeah. I see Kat has her hand raised.
Yeah, this is more of an observation or comment rather than a question, but I'm particularly interested in this work. I'm a registered nurse by training, and in addition to having a PhD. And in my prior clinical work, we worked with a lot of individuals who also worked shift work. And one of the things that we observed anecdotally in the clinic setting was you mentioned that shift work has an impact on their social life, but it also has an impact on whether or not they can make and attend medical appointments. So I know that's not one of your outcomes, but it affects their lives in so many ways that I think are underappreciated. So I'm glad you're doing this. And also, as a nurse, I would say that this kind of study of shift work can easily be, replicated in other populations like nurses, for example, because our sleep is just as disrupted when we're working, especially in hospital settings. So thank you for the work you're doing.
Yeah, Dr. McHill has a subsample of new nurses who are being trained and then begin on the night shift. So during COVID, he pivoted to recruit some nurses into his protocol.
Yeah, and I'm also thinking of pilots. My husband is a pilot, and I can see how his sleep schedule is impacted by his shift work as well.
Well, before we run out of time, I just do want to note that Dr. Stoffergen is the star of this work, and the pilot funding is supporting her work on this, I think, important project to keep this line of research moving forward. So just want to acknowledge Stacy, and glad she could make it. Like I said, I had the microphone today, but it really is a team project.
Thank you. It's good to be here.
Thank you. I think we have time for one more question. I'll just say really quickly, when you close your meeting, you'll see a survey pop up. It takes about 3 minutes, and we're always very grateful. And you can enter to win a $25 Amazon gift card as well. So that's just my plug. Please fill out our survey. We really appreciate it. It helps us determine how to arrange these events. And I'll let anyone who has another question speak.
Actually, Ryan, I think I have a comment. It would be really interesting, and that's maybe for Stacy as well. And I don't know if the work exists, but so one of the things is that with shift work in the traditional way, how we think about it, it is, of course, externally imposed. I mean, it's basically you, and you did this really nicely with the bus operators. I like that quite a bit because the junior ones have so little determination about their schedules. It would be possibly really interesting to look at self-created schedules. So if we think about Uber drivers, for example, so what is the control, that you have? And of course, that control is not completely free because there's a huge economic pressure on these drivers because they make relatively little money. But how does that affect, sleep patterns? How does this kind of control variable, the illusion of control, whatever you want to call it, how does this affect the outcomes that you're talking about? That would be, I don't know if there's work.
Yeah, there are definitely stories of people who choose and prefer the night shift for various reasons, and then morningness and eveningness, self-preference. So I think there's opportunities there.
Okay.
Thank you, everybody. I'm all feeling like a jazzed up nerd over here with these 3 studies and excited for the next round of what we get to learn about them. So thanks for submitting the project, and thanks for telling the broader group about them. And we are very excited for the next time that we get to hear an update.
Yeah. Thank you to UPower for the funding opportunity.
Yes, thank you so much.
It's good to have great projects to give it to. So happy Friday, everyone. I wish you a good weekend, and we'll see you again soon.
Thanks all.
Thank you.
And
Thank you.
Bye.
questionnaire, if you will, please. Thank you.
Yeah, thank you.
Thanks, y'all.